Great. Well, good morning where I am, and I'm so thrilled to join you all today to talk a little bit about some of the healthcare resources that you can tap into as rural farm families. I am Carrie Cochran McLean. I'm the Vice President of Government Affairs and Policy with the National Rural Health Association. And that's kind of just a fancy way of saying that I help to track on legislation and activities happening at the federal level that impact folks living in rural areas. So a little bit about the National Rural Health Association, if you haven't heard of us. We are a national nonprofit membership organization. We have over 21,000 members across the country, with individuals like yourselves, like your local healthcare provider, doctor, or nurse practitioner, and then we've got large systems, we've got researchers, we've got community-based organizations, and we all work together to make sure that rural communities have access to high quality, affordable healthcare. So with that, our 2021 priorities, and I hope these resonate with you, are really addressing some of the declines in life expectancy and some of the challenges that our rural families face in accessing and getting health care. We're looking at making sure that rural communities have doctors and nurses and pharmacists and whomever they need to be able to get care in their local communities. And then we're working to make sure that there is a strong safety net. The hospitals, the clinics, the nursing homes, you name it, that you and your communities need to stay healthy and get the care that you need. So one of the things I love about working in rural America and on rural health is it's just such an amazing place to work and live. I'm actually a fifth generation Montanan, so the other big M state, or another big M state, rural M state. And I just, while I live in Washington, D.C. now, I just can't tell you how much it means to me and my soul when I'm home and I feel very whole. Living in a community where folks know each other, where they're willing to pitch in and support each other, where we all have a communal work ethic to get things done, where we have innovation because it's what's needed to make the day-to-day survive. And so, I want to take a minute while we're going to talk about some of the challenges folks have in accessing care. I want to just take a minute to appreciate and celebrate the greatness of rural areas, because I'm right there with you. They're fantastic places, and we appreciate all you do to keep us all healthy and fed. So as we talk about healthcare in rural areas, there are a number of different kinds of doctors or providers or hospitals that you can access to get your care. And this, I think, is just an interesting map that shows specifically the healthcare facilities that are designated to serve rural areas. So there's a bunch of different dots here, as you can tell. The blue dot talks about critical access hospitals, or small hospitals that are meant to be your primary source of inpatient and outpatient care in your communities. You've got rural health clinics, which are providers that are serving rural communities specifically. And then you've got federally qualified health centers, and I'm going to talk about those also. And so hopefully you can take a look at this map and look at your county and get a rough sense of where you might have an access to care point if you're not already aware of it. So another resource for you, the Michigan Center for Rural Health is a state office of rural health, and there is a state office of rural health in all 50 states, and they are really meant to be a focal point for individuals, providers, and others who want to know about rural healthcare and access and information and what's happening in their communities. So they are a great hub to learn about all things rural health in Michigan. One of the things that's on their site that's really great, and I know a lot of this is web driven, and I know a lot of what I'm going to share with you requires internet, but you can go to any of these counties and click on the county, and it'll tell you and give you the address of the rural health clinic, the critical access hospital, and the emergency medical services near you. And so this is, again, another way for you to kind of tap into primary care and some specialty care in your local community. So just so you have that awareness and know about those resources. Another resource are the federally qualified health centers or community health centers. They also go by that. And this website, findahealthcenter.hrsa.gov, will take you to one of, I've lost track of how many health centers there are in the country, but one of a number of facilities that serve nearly 30 million people across the United States. And they serve 1 in 5 rural residents across the United States. So these centers provide both medical and primary care services. They're also a potential site for dental care, for mental health and behavioral services, for SUD, addiction services, whether it's opioid or alcohol or methamphetamines. They also have vision services and then other kind of what we call enabling services. So support services that can help you function in your day-to-day life. So if you need to know about a transportation resource or something for your kids or something for your elderly parent, or learn about a local food bank for you or a neighbor, these health centers can help you with those kind of wraparound resources. Another fantastic resource for you are your local county health departments. So again, the Michigan.gov website has a terrific resource where you can click on your county, and as you do, it will come up with the contact information, both the website, the phone number, and the physical location, as well as anything in terms of like flu or other kind of specialized resources where you can get care. So health departments can be a great place not only to find out about primary care and get your annual vaccinations or your kids' annual vaccinations, but they can really, again, help you tap into health and social services in your community that may just help make your life a little bit easier. On the introduction webinar that started off this series, I think it was Ashley shared that her county health department, if you call them, they can give you 6 complimentary mental health visits. So we all, including me and including probably most people have really kind of struggled during COVID with the isolation and the additional stressors we're all feeling in our lives. So county health departments can have fantastic resources to help you if you want some tips for self-care and mental health, as well as actually getting you connected with a therapist where you might be able to do telehealth services and just talk through some of the challenges you're facing and get some strategies and tools to make life a little easier. So definitely check out your county health departments as a potential point of care and tools. I should have probably prefaced this whole conversation saying my goal today is really to give you a broad range of tools so you can improve and make sure that you have a good quality of wellness and health. There is a lot of information about kind of what health conditions happen where and what kind of preventive screenings folks need and that kind of thing. And I'm happy to talk about some of those at the ending closing session for this series. But today I'm really trying to give you some quick and easy tips and tools for you to maybe make your life just that much easier. Oops. The other place I wanted to mention as a potential resource for healthcare services, but then also some of the social services that again help make our lives just that much easier and help us stay that much healthier, is your local school. And I think it was both Ashley and Rita in the opening session that talked about how I think it was Ashley said she went to her local school when one of her kids was having a challenge, and the school was able to give her a full compendium of resources in her community, everything from a dentist for her kids to see, to a therapist for her to talk to food banks that she could connect her neighbor to, a whole range of resources. So definitely check out your local school. The Department of Education website for Michigan has some great tools. I just kind of did a screenshot here, but it's another fantastic place to get some support. I wanted to take just a minute to talk about telehealth, because telehealth is one of those concepts that's been around for a while. And with the pandemic and with COVID-19, more and more folks have really been using it. And yet I think there's a lot of kind of questions around it. And not everyone knows how to access it. Not everyone fully trusts it. So I just wanted to spend a minute explaining what it is and what it might offer you, so that you can talk to kind of your local provider about whether it's a service you can tap into. So telehealth is basically just a way of getting healthcare using a form of technology where you and your healthcare provider are in different places. So that can be anything from kind of talking on the phone, like an audio-based telehealth. It can be video chat, like what we're doing now. It can be accessing your individual health record and say, hey, I'm out of this prescription. I'm just going to send you a note in my record so you can fill it and I can stay current on my meds and not kind of fall off of that. So, it can be done on a computer, on a tablet, on a phone, any one of the million kinds of mobile devices we have these days. And from my perspective, I use telehealth in my daily life, and it offers more access. Lord knows it offers more convenience and cuts down on all those travel times and distance that we all struggle with getting. Taking a full day off to get to the doctor, when, man, you might be able to just do a quick telehealth appointment and your doctor says your kid's rash is nothing to worry about and you can stay home and get on with your day. It also can reduce the stress of going to a provider and your risk of getting exposed to something, especially in the time of COVID. And it also just keeps you connected with your healthcare provider. So you might not feel like you need much more than your annual physical, or if you even need your annual physical, but it's always good to kind of stay in contact with that individual and have that primary care relationship. And there are a whole bunch of services that you can get through telehealth. Now, your doctor may not provide all of these, but you can do everything from a basic physical exam wellness visit to kind of treatment for your chronic conditions. I know I'm on a medication where my doctor wants to check in every quarter or so, or every once or twice a year, and it makes it so much easier to be able to do it via video. You can get mental health counseling and therapy. Dermatology is amazing what they can do. I won't read all of these, but it gives you a good sense of kind of the breadth of resources that are available to folks. So again, talk with your local provider. The Michigan Department of Health website has some information on telehealth, especially for pediatrics and for kids. So it's another important resource to think about, especially during the pandemic when we're all kind of a little bit more isolated than we want to be in terms of both our physical and mental health. Wanted to spend just a minute on a topic that is, I think, one that a lot of us have really struggled with for a long time. Pre-COVID, I think the issue with opioids and other substance use is getting worse during COVID, and we're going to come out of this, and there's going to be a whole need for resources specific to opioid use and other kinds of illicit substances. I know I'm from Montana, and methamphetamines is just a huge issue there. So I wanted to make you aware of the Northern Michigan Opioid Response Consortium program. They have resources not only for providers, but for individuals who are looking for recovery and other kind of tools for families. So everything from a directory on where you might be able to get connected to Alcoholics Anonymous or Narcotics Anonymous online, like online meetings. There's resources for families, all sorts of things. So just wanted to make that available to you in case this is something that you or a loved one are struggling with. There's a lot of folks out there right now who are in that boat. I also feel like I need to touch on COVID-19 because you can't talk about healthcare right now without talking about COVID-19. The Michigan Center for Rural Health, again, your state office of rural health, has a number of resources around COVID-19. Again, this is their website, and everything from kind of where you can get your vaccine, where you can get tested, kind of if you're looking for kind of some mental health supports around it, if you want to connect with kind of other kind of state resources, all of that is on this website. So, you know, a good thing to tap into if you need to know more about COVID-19. I also wanted to flag for folks that while you know, having healthcare coverage is so important, and it's a first step to getting access. And I don't need to tell you all that as farm families, but I did want to flag for you that due to kind of the COVID-19 pandemic, the getting health insurance and that window, that open enrollment period to get insurance has been extended through August 15th. If you're looking to enroll in a marketplace plan through your state. So this website, if you go in and look to apply and find out what's available to you, you can get help from a local assister on learning more about what kind of plans are available to you and your family. You can learn about the kind of financial support you can get through the program. So cost sharing reductions to lower kind of your copays, or tax credits for your premium costs, depending on your income. There's also a resource, knowing that many of you are small employers, there's also a resource called the Small Business Health Options Program, or SHOP. And it is targeted or created specifically for small employers who want to be able to provide some kind of health or dental insurance to their employees. And so it's for businesses between 1 and 50 employees. So you can find out about that on this website too. And again, open enrollment is happening all the way through August 15th. So you can sign up for coverage at any point during that. And last but not least, I wanted to provide some general wellness resources for you. As a working mom and, you know, all of the hats that we wear in life, and the very few breaks we get in life, especially around COVID, it's really important that we're taking care of ourselves in addition to our farms and our employees and our families and everyone around us. I think it was, I can't remember who it was in the earlier session, was talking about how while it may take a half a day off to go get check in with your doctor and get your back checked out or get that health screening, it means that when you come back to work, you're healthier and more rejuvenated and better able to take care of the people and the things and the jobs around you. So I just really encourage you to check out some of these wellness resources. There's some specific to women by age and then men by age. And just, you know, take a minute. I know it sounds so crazy, but try to take a minute for yourself in the stressful day-to-day we all live in, and really invest in yourself and invest in your healthcare. So with that, I am done, and thank you so much for having me here. The last slide that I think I might have flipped past has my email address on there, and so you're always welcome to reach out and connect. If you have any questions or want to get connected with a local resource, I'm happy to help you with that. So thanks so much, and have a great rest of your day.
Hi, everybody. My name is Mike Romano. I'm the Senior Vice President with NTCA, the Rural Broadband Association. I am delighted to join you all as part of your Farmers After Hours series to talk to you today about critical connectivity, rural broadband, basically, and try to provide you some insights into why things are the way they are in terms of rural broadband right now, and some thoughts and resources for what you all might do to help make sure that you all in your communities and in your business operations have the opportunity to get the best possible access to broadband that you can moving forward, knowing how important it is to everything you do and how important everything you do is to the rest of the country. So why is rural broadband so important? Stepping back, I think a few things obviously come to mind, top of mind in the pandemic. Telework, of course, a number of people have been compelled to work from home, either under state orders, in some cases like yours, or in other instances, folks have just been forced to stay at home as offices have closed, facilities have shuttered. Remote learning, students being compelled to stay at home to learn, maybe going back into hybrid situations. And then telehealth, the ability to consult with physicians, medical clinics and the like. All of these things have applications well beyond the pandemic, of course, and probably will see some lasting benefits in terms of these applications coming out of the pandemic. But certainly the pandemic has highlighted the importance of all three of these and many other applications too. One thing in particular I think we've seen quite a bit is the two-way nature of networking. The fact that it's not just streaming videos, it's not just watching Netflix, it's interacting with others, it's participating in two-way conversations via video conferencing, it's consultations with those doctors again, it's uploading data, as we'll talk about, to the cloud, substantial amounts of data. All of those things go into why rural broadband is so important. And obviously in your business, it's such a critical piece. You represent such an important part of the US economy. I've got some facts and figures there that we just actually are recently citing in a paper that we're putting together, talking a little bit more about the role of rural broadband in precision agriculture, which I also have noted here. But obviously broadband is an important piece of engaging in a more competitive global marketplace and giving you greater efficiencies, greater reach for your products as you look to put them into this global marketplace. In terms of precision agriculture, this has obviously attracted a lot of attention these days. We've seen GPS guidance, drones, monitoring of livestock and things like that just have become so important, and broadband has become so useful to those functions. The one thing I want to note is that folks often think about these things as sort of in the sky, in the air, and spectrum, wireless. Obviously, a very important piece of the puzzle, but it's more than that. There's so much that goes into rural broadband and goes into the networks, and I want to share a little bit of that with you, because especially given the speeds we're talking about trying to achieve, given the applications that we're trying to fulfill, and the amounts of data you're talking about, wireless needs wires, and we're going to need a complementary set of networks that do both to really fulfill what you all need in both your personal lives and in your business. So I'm going to do a brief detour on broadband networks. I'm covering the complexity of this in just a slide, but what you see on the left there is basically a small cell deployment and fiber. And those two really go hand in hand. You can see above the small cell deployment, some of the wires that are going up there. Some of those are power, but some also, a lot of wires underneath that feed into it. These are cables. And on the right, you see a typical sort of broadband deployment with a wireless context. You see there, all those green lines on the right, that's fiber. That's wire. Those are wires that are connecting to small cells, the thing in the upper left here, the picture in the upper left with the boxes, that are then feeding wirelessly and giving information and pulling information from users on their cell phones, on tablets, on connected tractors, whatever it is. And so as you'll see, wires and wireless networks combined are really critical to making sure you're getting the best possible broadband. These devices are not walkie-talkies. They're not operating just on spectrum. They're hopping back to the closest cell, the closest tower they can get on, and immediately aggregating upward to get more fiber capacity into the network. So why is rural broadband so hard? I tend to think of this as two relatively simple problems that can be described as both starting with D. And the first is distance. This is a picture that I took actually when I was out in Montana several years ago of a number of folks basically burying fiber cable in the ground across fields in eastern Montana. Distances are great. Distances are great both to reach the rural areas and then even within the rural areas between households. So distance is just a significant factor in putting out networks, whether it's wired like you see here or wirelessly, as we looked at in the last slide, where you're talking about trying to transmit data across wide swaths of rural areas. Spectrum only lasts for so long, it only propagates for so long. So you need to have, again, these wires and these wireless connections together across great distances in order to achieve the capacities and capabilities you want. So distance is one of the first challenges. Why else is rural broadband so hard? density. Of course, it's a follow-on from distance. But this slide, I think, is neat. It comes from, the pictures here come from a report that we had done a couple of years ago, looking at what density means. And it's a relatively simple, but I think really good depiction of what's involved here. If you look at those red lines, those are all the facilities to connect broadband to all these houses. And if you look, you can see it's the same amount of facilities to connect the houses, whether you've got 1 per block or 4 per block on the left side of the screen. But it's, you're only getting so many customers on that fiber, on that connection, if you've only got 1 per block. And so you're spreading the cost out differently when you've got 4 per block versus 1 per block. And of course, we see this in rural areas. The densities are low, the distances are great. If the average density is below 7 per square mile, it's really hard to make the business case to deploy broadband in such an area, at least without maybe some government programs of the kind like we'll talk about in a little bit here. So that sort of defines the uneconomic area. Distance and density tell you what are the areas that are harder to more challenging to serve, and thus present special cases that might need assistance from various programs. And this map comes from that same report as the charts I had in the last slide, showing what this consultant, in this case CostQuest Associates, had indicated as being the uneconomic areas to serve to deliver broadband in the United States. And the areas in red and orange in particular fall into this, and then the yellow too, to some degree, are uneconomic. They're borderline, if you will, and the green are the areas where, frankly, the business case can clearly be made to invest in broadband. So as you see, and if you drill down into individual states, and like Michigan, for example, there's a lot of orange and a lot of yellow there and some red too. And as you get out west into some of the really uninhabited areas, it gets really red really fast. But the point is, those are areas where it's harder to deliver broadband because distance and density, among other factors, present challenges. You also have, topography. You've got the fact you got hills or trees or foliage that get in the way of, for example, wireless lines of sight that make these things harder as well. The point is, we've got a lot of uneconomic areas that are hard to serve in terms of delivering broadband in rural America, and we've got to find resources and be resourceful in overcoming those challenges. And that's a little bit of what I'll talk about now. So what to do about this? What's being done? There's an alphabet soup of solutions out there from a variety of agencies, federal and state. The first and foremost I think of often is the FCC, the Federal Communications Commission. Those are the folks who regulate broadcast TV and do other things like that, but they also spend a ton of time on sort of broadband mission, thinking about universal service in a broadband world. They do a lot with spectrum. So they have programs under their high cost universal service umbrella, which is a statutory program that distribute about $4.5 billion a year to an alphabet soup of programs under that high cost universal service umbrella. There's the Rural Digital Opportunity Fund, the Connect America Fund, any number of programs, but each of them is attempts to target areas where the business case for broadband doesn't exist and helps to try to foster that business case by providing support that allows the provider to make sure they don't have to charge the customer an exorbitant rate in order to deliver service. No one wants to pay $300 a month for broadband. These programs are critical in making sure that the provider can charge more like $70 to $80 a month, and then there's support to make up the difference. Now, the FCC really doesn't do capital funding. They don't do infrastructure funding. They do more of the support funding. Other programs, however, do aim for infrastructure or capital investment, and those are the remaining ones on the screen. So for example, you've got USDA, the Rural Utility Service, which does a variety of loan and grant programs in order to help provide people with the upfront financing to build networks in the first instance, presuming they can make the business case through things like the Universal Service Program or just on a standalone basis. But these programs are critical to getting access to the capital needed to build a wired or a wireless network in very low density, sparsely populated areas. NTIA is an agency under the US Department of Commerce. They are relatively new to the broadband funding game. They did some stuff 10 years ago or so, but now they're stepping back in because Congress gave them over $1 billion broken up into several buckets, a couple of which are here, to help provide seed capital for broadband funding that are going to go to states and localities or to tribes. And then the states themselves are getting increasingly into this space. The CARES Act, which is one of the earlier coronavirus relief packages, and then more recently, the America's Rescue Plan Act both of those contain funds that are going to state and local governments for use for any number of purposes, but broadband is expressly included, at least in the American Rescue Act. And certainly folks use CARES Act money as well for that purpose. So as you can see, there are a lot of cooks in the broadband kitchen, a lot of potential places to turn if you're looking for funding, especially if you're a provider in this business, to look for funding to help find the way to build these networks in some rural areas that sit unserved today. So why hasn't this happened sooner? What are the roadblocks? So first, the first roadblock, I think of these in a few simple questions: where, what, and who, basically, or where, why, and who. But one of the first is where. Part of the problem that I think we've had is a lack of access to good data. People are very frustrated that there are maps out there that give false positives. They show that broadband is somewhere where it actually is not. And part of that's a problem, but we have a system that really wasn't built for the purpose of tracking broadband reporting at all, but has been used for that because it's the best possible system we've got. So for example, in this map I've got here, and I've got the site to link to it down the bottom, the FCC has an interactive broadband map that can show you fixed broadband deployment, wired or wireless, to individual locations around the country. But it doesn't actually show that to locations. It shows it on a census block basis. So in theory, if I'm in Michigan and I've got a neighbor who's 3 miles away, and that neighbor has a fiber connection to their house or a robust wireless connection to their house, if I'm in the same census block, I look served even though I don't have that connection. And so money is not going to get to me for under those programs I talked about previously, because I'm going to look served. And so fixing the maps is probably one of the first most important things we need to do to make sure the money actually gets to places where it's needed most. The good news is there's work underway to do that. Finally, Congress gave some money late last year to enable the FCC to fix these maps and do them right. So I think over the course of the next 12 to 18 months, we'll really see improvements in mapping and hopefully find a way to get funding more to where it's needed. So who should be getting funding and who should be running the funding? You've got any number of agencies, as I said, who are cooks in the kitchen here. Sometimes they don't necessarily coordinate and talk to one another very well. So sometimes you may have agencies potentially providing duplicative funding at the federal and state level for an area that doesn't necessarily need two sets of programs funding it, while another area sits without any funding. So that's a real challenge too, and something that coordination among all those different alphabet soup of programs and agencies is really critical. And it's hard to do because everybody's racing forward trying to fix the problem as best they can. But sometimes it's helpful to stop and think, well, if the FCC is already giving money here, does the state need to as well, for example? And then the what. This is a big question. It's becoming a bigger question over time. So on the left, I've got a gravel road there. It's my son actually riding his bike down a gravel road. And on the right, I've got a superhighway. Gravel road's cheaper to build, but it's not necessarily built for the future. The superhighway takes a lot more investment up front, but it's probably going to last you a lot longer. And that's kind of the debate that's happening in the broadband world right now. There are a lot of folks who are saying, let's get everybody the bare minimum we can, as best we can, the gravel road, before we start investing in superhighways. The problem with that is you're talking about infrastructure investments that are meant to last 10 to 20 plus years. If you're going to build it right, or build it once, you might want to build it right, build it once. And so the superhighway, while it might be more upfront, there are a lot of folks who believe that, including us, that that's probably a more efficient investment over the life of that asset. It's going to deliver a lot better service for the rural communities. It's going to be a lot more like what urban areas get. So what are resources available there for folks who are interested in this and thinking about this, trying to figure out a way to crack the code on how to get better broadband? First thing I would say is, for better or for worse, even though they're not in perfect shape and need improvement, you've got the current FCC maps. I've got that link up there again. So you can go in, you can enter your address, you can look and see how many providers does the FCC think I have there. Do I really have those? Maybe, maybe not. Some of those are based upon advertised speeds, not actual speeds. Some of those, again, are based upon the fact that my neighbor a couple miles away gets that service provider, but I don't. So they're not perfect, but they're at least a starting point for folks to try to identify who might be out there in the area. A new thing that's just popped up in the last several days, actually, and it relates to that funding that I said Congress gave the FCC for mapping, is a new crowdsourcing effort. And I've got the link there. It's too early to say what this is going to be exactly, but the idea behind this in theory is, if on the map the FCC has, for example, it shows that you have provider X, but you don't have provider X, or provider X says they can do a certain speed, but they really can't deliver that speed. The crowdsourcing effort is a way that you can, in theory, submit this information to the FCC and basically say, no, I don't believe somebody's actually doing what they say they can do here. And the FCC will gather that and process that in some way. It's not entirely clear yet, but ultimately, hopefully develop better maps based upon that kind of feedback as well, and hold providers a little more accountable to be forthright and honest in what they say they can do and where they can do it. State broadband offices are another important resource. There are a number of offices, states that have started to look at this and say, broadband is an important part of our economic development strategy, especially in rural areas, for example, and especially in the agricultural business. So we're going to set up an office that is focused on sort of broadband policy and broadband as a component of economic development. And we see that increasingly across the states. They can be good resources as well in terms of figuring out what a state's plan is for bringing better broadband to its users, what resources that state has that might be available for consumers and businesses. They really can be a good point person for many in terms of on-the-ground knowledge of what's happening in the state. And then the last resource I would just mention are local and neighboring providers. NTCA members, we represent about 850 small rural providers. Our members are cooperatives and family-owned companies based in the areas they serve, formed 50 to 100 years ago when the community came together to build telephone service back in the day when Ma Bell wasn't bringing telephony to rural America. So they're now all broadband providers, and there are providers, we're proud of what they do, and there are other providers like them out there too. Turning to a local or neighboring provider to say basically, hey, is there anything you might do to extend broadband in an area where it's not, is a really potentially valuable conversation to have. These kinds of partnerships we found are critical in getting broadband projects off the ground, in coming together to find better resources, and making a politically powerful case for having a knowledgeable, experienced party in the delivery of broadband, which is not an easy business, together with folks in the community who are focused on getting better broadband. So I would strongly encourage people to think about reaching out to their local or neighboring providers to talk about partnerships, to talk about expansion opportunities if you're lacking in broadband. So how do you get involved? How do you make sure that you can make a difference? Again, organize and be your own advocate. Talk to others in your community who are facing these challenges. Talk to the Michigan Farm Bureau. Talk to others who are going to be able to tell your story and say basically why you need broadband, and then make the case for what kind of broadband you need too. Don't settle. And I've got that as a third bullet, but I probably should have put it right in second. Aim higher. Don't settle. We see a lot of folks saying, well, I'll take this because it's good enough to give me something that I don't have right now. That's useful. I get that dynamic, but at least in your asks, start off by not settling. You want the same kind of access that folks in urban areas do, and they're getting increasingly higher speeds over time, much higher than a bare bones sort of interim network is going to give you. So organize, be your own advocate, and aim for the best possible broadband you can get to start. If you have to settle on something later, that the economics of an area might require that. The providers available in an area might not be able to do anything better, but aim higher to start. And then finally, again, that point in the middle there, look local, think partnerships. Look to your local providers, look to somebody who's also invested in your community, look to somebody who's a broadband provider who's serving their neighbors, their family, their friends, their kids' schools, their grandkids' schools, the libraries, the hospitals in that area, and see if they can find a way in partnership, maybe using some of the resources that are available from the federal or state government, to help edge out their networks into areas where it's lacking today. It doesn't always work, but it's probably one of the most promising places to start, and in many cases it has indeed worked. So with that, I thank you for your time. I hope that you all have learned something in terms of potential resources and programs that are out there to help you with this and ways to find information. Look forward to continuing the conversation with all of you and your representatives as this moves forward. Appreciate your commitment to rural America as well, and look forward to continuing the conversation moving forward. Thanks so much.